Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. In this presentation, we're going to look at the various aspects that are involved with cardiac rehabilitation. Who needs cardiac rehabilitation? What is done during cardiac rehabilitation? And why it is important for you to get engaged in a cardiac rehabilitation, especially if it's available in your location. So let us begin with the feature presentation. Welcome to Triple N Media. We are going to be talking about cardiac rehabilitation after a heart attack or heart surgery. It is very important for a person who is new to coronary artery disease, who has been newly diagnosed to have a heart disease, or who had a heart attack, or who had surgery, to go through this cardiac rehabilitation, because it is going to transform you as far as your lifestyle is concerned. It is absolutely essential for you to understand the gravity of the situation when you have been diagnosed to have a heart problem, especially a heart attack, or if you had a heart surgery, and what are the things that you need to do. The things that you need to be engaged is going to be lifestyle changes, which is going to be for the rest of your life. You can no longer be doing the things that you were doing before you had a heart attack or heart surgery, and the things that you're going to be doing now or learning to do will be the new lifestyle of yours for the future. Let's look at the main components of a cardiac rehabilitation, which is very comprehensive, and it covers much more than just doing some simple exercises. This is a composite overview of the cardiac rehabilitation. Once your doctor decides that you had a heart attack, now you're recovering from the heart attack, you need to go through this cardiac rehabilitation, which can last for several weeks, 6 to 12 weeks, depending upon the location and the facilities that are available. But the important components of this entire cardiac rehabilitation is about re-educating you as to what your lifestyle should be. First of all, as the doctors and nurses and a whole team of healthcare experts assess your clinical condition. Then you're going to have a nutritional counseling by a dietitian. They will tell you exactly how much carbohydrates you should be taking, how many grams of proteins you should be taking. They will tell you as to how much fat you should be consuming and the types of fat you should be consuming. The next component is weight. Of course, weight is a major issue when it comes to a patient with a heart disease, as extra weight adds to other risk factors such as hypertension, diabetes, and all other problems, hyperlipidemia. So bringing down the weight is of paramount importance, and they will guide you as to how you can, with nutritional and exercise modalities, how you can reduce your weight. Blood pressure is an important risk factor for heart disease, and higher the blood pressure, the higher strain your heart will experience. So bringing down your blood pressure to like less than 130 over 80 millimeters of mercury is of great importance, especially in the presence of a heart attack or if you recently had a heart surgery. Lipid management. As you know, cholesterol is directly related to the incidence of plaque building in the arteries that leads to heart attack, which leads to heart failure, and bringing down the cholesterol level is of great significance. And after a heart attack, many cardiologists would recommend you to bring your LDL, the bad cholesterol, to less than 80 milligram percent and the HDL to be more than 30 or 40. It is very hard to bring the HDL higher, with the exception of exercise, which will bring the HDL level higher. But still, you need to be able to make sure that you bring your total cholesterol level below 160 and the LDL, the bad cholesterol level, below 80 milligram percent, and that will help to reduce the rate of progression of the coronary arteries. And of course, diabetes is one of the major risk factors for heart disease. Control of diabetes, control of blood sugar levels will help to regulate your not only the glucose levels but also the lipid management, which will play a significant role. Tobacco goes without saying is one of the major risk factors for heart disease, and you can forget about smoking. You can forget about smoking for the rest of your life, especially if you had a heart attack or heart surgery. In fact, many of my patients who had heart attack stopped smoking cigarettes the day they were admitted to the intensive care unit. It is the most powerful deterrent for smoking. You don't need to have a heart attack or heart surgery to quit smoking. It's better you quit smoking before you have a heart attack or before you need surgery or stent. A person who quits smoking 1 year after cessation of smoking will have the same risk as a normal person. So there's a great advantage and incentive in cutting smoking altogether. When somebody has a sudden transformation of their life from a laissez-faire, party going and dining and all these things to a person who has a heart surgery or a heart attack, now you're going to go through certain emotional experiences. Some people, almost 30% of the women go through depression after a heart attack. So your psychological and social environment needs to be addressed, and if you need help, you need to talk to your cardiologist. You may want to see a specialist to help you get through this period, because this is a life transformation process. It is not just another hospital visit for a cold or a flu or a pneumonia. This is a life-changing event, and that's why you need all multi-modality approach to reduce your cardiovascular risk for any future events and make you functional normally as you were before, but as a much healthier, more sound person. Physical activity. It goes without saying. Any person who talks about cardiac rehabilitation automatically assumes you're going to be involved in some kind of exercises, muscle strengthening, aerobic exercises. Yes, indeed, you're going to be involved with aerobic exercises. And the most important part of cardiac rehabilitation is the teamwork. You're working with a team of experts and you're working with colleagues who have similar interests. So you make new friends and you develop new habits and you have a new lifestyle. And these things are going to make a huge difference for the future. And your family will notice the difference, and maybe that will inspire other family members to follow the same footsteps you're doing, so that your siblings or your other family members don't end up with a cardiovascular problem like you did, so that they can be in a more preventative mode versus trying to be reactive to a heart attack or a heart surgery. And exercise, of course, they're going to get you on a gradual graded exercise program, and by the end of this rehabilitation you should be able to walk a mile or more easily without having any cardiovascular symptoms. That's the aim. And so this is a composite overview of cardiac rehabilitation, which comprises so many different aspects which you may not even have dreamt of. So ladies and gentlemen, make sure that if a cardiac rehabilitation is available at your location, you use the resources so that you become a much more educated, wiser person to deal with your heart condition and live a more productive life. I hope this has been educational and useful to you. Please do subscribe to our YouTube channel. We have more than 300 videos talking about heart healthy lifestyle for the general public. And I will see you in the next presentation. Thank you so much.